Hello, everyone, and welcome to our May 5th, Cinco de Mayo COVID-19 vaccine update. Next slide. So as we think about getting shots in arms, I want to remind everyone of our wonderful volunteers and the support we have to get shots in arms. And we have here the National Guard, but many thanks to the hospitals, healthcare professionals, FQHCs throughout the state who are working to get New Mexicans vaccinated. So thank you. Next slide. So as far as efficiency, looking at the number of doses delivered to our state relative to the number of shots in arms, we are really leading the nation in getting those shots into arms, and we're very efficient. So I'm very proud of New Mexico. Next slide. So as far as our progress with vaccinations, to date, nearly 59% of New Mexicans have received at least a first shot, and 45.4% of New Mexicans are fully vaccinated. Next slide. So when we think about our press conference last week with the governor and our goal of reaching 60% of the state by June 30th, we are on track. And when 60% of New Mexicans have been fully vaccinated, we will graduate from the red, yellow, green, turquoise county color system. So that will be a really great day. Please keep in mind that sovereign communities, sovereign nations may operate according to different guidelines. Next slide. So I want to highlight the populations we're going to be moving to include in our vaccination efforts. So currently, we're also vaccinating those who are 16 to 17 years of age. And so if you've not registered and you're 16 or 17, please do so. So far, we've had 30% of this population with at least one shot, which is really great news. We are awaiting the emergency use authorization for those 12 to 15 years of age, and we're expecting that very soon. But right now, you can register your child between the ages of 12 to 15 for the vaccine, and that's vaccinenm.org. And already, nearly 10,000 12 to 15-year-olds have registered. I want to highlight what we're doing to further have outreach to get shots in arms. We have our FEMA Urban Mobile Unit, or what we call FUMU. We also have the New Mexico Equity Travel or NET team working with the National Guard. What we're looking at is that we're having to do more smaller targeted events versus our larger events. But this is going to take everyone's effort to get shots in arms, and we really encourage all of New Mexicans to get their vaccine. Next slide. I want to highlight a key partner, and that's primary care providers. A primary care provider is in a unique position to hold very meaningful conversations with patients about the value of the vaccine. And so as our key partner, I'm speaking directly to our primary care providers, please reach out to your patients, encourage them to get vaccinated, and offer vaccinations to patients who are visiting you for other reasons. And I'm going to thank you in advance. Next slide. So if you want to become, and I'm going to say, please become a provider, this is the link where you would go to get enrolled to become a COVID-19 vaccine provider. Next slide. And again, I want to thank our primary care providers for all that you do. And it's very important that we have your support. And I really appreciate knowing that as a fellow primary care provider, we're working together. Next slide. So as far as what's coming soon, on-site vaccination events for organizations, and we will do web-based requests so that you can make your requests known. Businesses, nonprofits, religious organizations, schools, and others can request an on-site vaccination event. So that means we're coming to you to get shots in arms. Next slide. And again, New Mexicans can schedule their own vaccine appointments, and you can also self-schedule your boosters. So please go to vaccinenm.org. Next slide. So I want to reiterate, as we've been talking about, Pfizer, Moderna, and J&J, the 3 vaccines we have available in the US, they're all safe and effective. Please take the first vaccine you're offered. Keep in mind vaccines, testing, COVID-safe practices will keep more of our loved ones from being hospitalized or dying due to COVID-19. Next slide. Do keep in mind the vaccine is free to everyone. We will not collect Social Security numbers or government ID, and it is something that we want to make sure everyone has access to. Next slide. The state of New Mexico does not share immigration status information with the federal government. Vaccine sites are safe. And next slide. So if you need support getting scheduled, please call 1-855-600-3453 and press 1 for English, 3 for Spanish. Seniors and those with disabilities can call the 1-800-432-2080 for support with registration and scheduling. And if I said that too fast, I'm going to say it again. For seniors and those with disabilities, you can call 1-800-432-2080. DOH and Aging Long-Term Services Department are also calling to schedule seniors. And we're also reaching out to New Mexicans with disabilities and others who require special accommodations. Next slide. To date, more than 900,000 New Mexicans have registered for the vaccine. If you have not, please register and self-schedule today. Next slide, please. So keep in mind that we are here to listen. We want to understand the questions you have, the concerns you have about the vaccine. And so we're reaching out through town halls, through our network of community health workers and other outreach methods, to create a climate of listening and really respectful dialogue. We want to provide clear and validated scientific information about COVID-19, about vaccines, and related health topics. Next slide. And one of the things I want to highlight would be our trusted voices. We have more than 60 community leaders who share their vaccine experiences. And it's really important that we have more of you sharing your vaccine experience. And I want to highlight Mr. Adrian Sandoval, who's the new director for the Center for Education and Study of Diverse Populations of New Mexico Highlands University. And I'd like to play his video, if we can.
Hola, ¿qué tal? Soy Adrián Sandoval. Como ustedes saben, yo soy parte del liderazgo que tenemos en CSDP con la Universidad de New Mexico Highlands. Quiero compartir con ustedes que ya hace como 2 o 3 semanas recibí... Perdón. Puedo comenzar otra vez, ¿verdad? Bueno, vamos a hacerlo rápido, adelante. Sin problema esta vez, ¿eh? Hola, ¿qué tal? Soy Adrián Sandoval. Como ustedes saben, yo soy parte del liderazgo de CSDP, conectado con la Universidad de New Mexico Highlands. Quiero compartir con ustedes que ya hace como 3 semanas recibí mi primera vacuna, ¿verdad? Y me siento bien, totalmente bien. Hasta voy a recibir la segunda vacuna este sábado. Sé que hay algunas preocupaciones sobre los efectos secundarios, pero no tuve ninguno. Mi brazo estuvo adolorido un poco ya el día después, pero aparte de eso, nada. Así que adelante, hagan una cita y nos veremos ahí y ojalá que ustedes aprovechen de esta oportunidad. No se les olvide usar una mascarilla y siguen, por favor, lavándose las manos y manteniéndose a una distancia, ¿verdad? Saludable. Adelante, hasta pronto. Bye bye.
And many thanks to Mr. Sandoval. And I believe we have one more here that we're going to highlight. Okay, so we could go to the next slide, or would we like to show this one as well? Okay. So I want to highlight we're on our way, New Mexico, and I'm going to turn it over to Dr. Scrace. Thank you so much.
Thank you very much, Tracy. I actually look forward to these press conferences every every other week just to see the amazing progress we're making in the vaccine effort. Again, we apologize for the delay in getting our broadcast live, a change in the Zoom settings for Facebook streaming, and we figured that out. Gave me time to put up my Cinco de Mayo decorations for our press conference today. So I wish you all a happy Cinco de Mayo. This is an anniversary for me. I moved in New Mexico in 1998 on May 5th. I want to take a little bit more time to update you on variants. Today, you know, it's all over the news, and we've been giving you the numbers of 117 in particular and the California variants. But as we continue to process the data, as EPI continues to put together what looks like it's going to be an excellent variant report that will be available online as soon as we have that finished. You can see here today that these are the variants that are run through our state lab. Also, one of the mail-in labs we use, Curative, does some of this variant analysis. Also UNM, also LANL. And so it's not a completely random sample, but it's a representation. And if you look on the left first, you'll see that that orangish, whatever that color is, I'm not good at colors, but the one that says B117 on it, has really grown from a sliver in January 30th in the United States to the majority, actually, of the virus, coronavirus infections in the United States. So why is that of concern? Is the B117 vaccine resistant? Is B117 resistant to the vaccine? Well, we have good data from Pfizer so far that suggests that it's not. We'll be getting Moderna data, we believe, as well. Is it resistant to treatments? Yes, it is. And so we have actually stopped using bamlanivimab alone and switched to one that would cover the B117 variant. We did this back when we'd only sequenced a couple of variants, so we were ahead of the game there. Does it make people sicker or create more hospitalizations or even deaths? So far, no. The uptick that they saw in London has been reported in the Lancet and other medical journals. It looks like it does not create more severe disease. And then the last one that should be of concern to all of us is, does this spread more rapidly than other variants? You know, that if you look at on the chart on the right, other lineages, or at the colors on the map on the left, all those others are what we've been seeing with COVID up to this point. And the fact is, there is good data that it does seem to spread more rapidly. You could intuitively guess that by looking at the increasing orange bars on your left. But the data in the medical literature from a couple different sources now is it seems to be 30 to 40% more likely to spread. For those of you who remember the term R effective, that spread rate is 30 to 40% higher. And so right now, these variants of concern that you can see here, the United Kingdom one that we've been talking about, 117, the California variants, et cetera, Brazil and South Africa. It used to be that B1.2 is all we saw in New Mexico, or almost all we saw. So that's basically going down substantially, less than 5%. And at this point in time, actually almost 2/3, or 70% of all of the infections, if you extrapolate from the sequencing we're doing, are from these variants, which are more likely to spread. So I do want to pause on that note. I don't think there's any cause for people to panic about this, but it should reinforce the importance of getting vaccinated to everyone. If this is, you know, a 35, 40% more likely to spread, should underscore the importance of continuing to wear a mask. The best defense against any new variant is getting as many New Mexicans vaccinated as we can and having as many of us wear masks as we possibly can in virtually every situation indoors. And then even when you're in a restaurant, I would really encourage everybody watching and listening today to keep that mask on, particularly when the servers come up and you're conversing with them, but all throughout the meal when you're not actually eating. And when I go to a restaurant and I'm going to drink something, I lift my mask up and take a sip. When I eat, I take it off. But please be careful. These variants spread more rapidly. Next slide, please, Alex. This is just one of those studies that I mentioned. This is a lot of people, almost 23,000 people who were studied. This actually is healthcare workers in New Mexico. And by the way, in our state, about 80% of healthcare workers received the vaccine so far. So highly popular among those who take care of COVID patients, and something that should again motivate us to get the vaccine. The vaccine about 70% effective in 21 days, 85% effective in after the second dose, 7 days later. You know, I've talked to people like, well, I got the one dose, isn't 70% good enough? And, you know, I like to point out that, you know, diabetics don't take their insulin for 6 months a year and then stop it for the second 6 months. People don't take their blood pressure medicine in even numbered months. I mean, the prescribed course of the vaccine and all the evidence is really the 2 doses, and that's what's going to best protect us. And I know Secretary Collins is very firm on this point. When we talk about vaccination, we talk about the complete series. And so good effectiveness, but also in this study, during the rise of 117, there did not seem to be any breakthrough among those vaccinated getting 117 infections. So that's good news. Next slide, please. Okay, back to our epidemiology curves. I know we have some very regular watchers and you're very familiar. Just to reorient people, the top line, that blue line that is sometimes dotted, is the total number of cases per day, averaged over 7 days, and there's a 6-day lag to let some of those later lab reports come in, although we do very well on lab turnaround these days and contact tracing for that matter. We are at somewhat of a plateau. I think our epidemiologists look at that blue curve near the end and think is trending upwards, and I have to agree with them that there is a little bit of upward trend there. We have to watch that closely, again, get vaccinated, but we're still basically vaccinating 50 people a day for every new case we see. And if we can keep up that pace, I think we've got a good shot at keeping this pandemic under control. Next slide, please, Alex. And then these curves, the green one on top is the same as the blue curve I just showed you. You can see that plateau. Hospitalizations, which did edge up a little bit, are now coming back down throughout most of the state, although in San Juan County, I heard reports today that they're seeing a higher rate of hospitalizations before. And finally, we're seeing a steady, relentless downward trend in the number of deaths per day. Many days this past week, we've had one. Over the weekend, we had 3, over 3 days. And so that is really good to see. And we also are seeing more young people, as we have throughout, being the ones who are getting sick and even being hospitalized, but with shorter lengths of stay and apparently a little less severe form of illness. Next slide, please. I just wanted to update you. You know, we went to the new red, yellow, green, turquoise system. It's exciting what's happening to the color of the state. These are the rules. I'll say a little bit more about vaccination rate, but this week, today, or on Monday when we did all the data for the report for today, the target was 40%. And keep that number in mind as we go forward. But we did introduce the vaccine metric. We also relaxed the daily case rate to 10 or less and the test positivity rate to 7.5% or less, because we thought we could accommodate a slightly higher amount of disease activity. So, and remember, turquoise locks in 4 weeks. I'll say a little bit more about that in a minute. Next slide, please, Alex. Gating criteria, spread rate up a little bit. It's at 105. It's really 1.052, so it's a little above 1.05, which is why it's a red square. Daily cases, a little high. Everything else functioning normally. We've built in the new targets for both the daily case rate and the test positivity rate. As you can see here, 210 cases is the equivalent of 10 cases per 100,000. And we have dropped the PPE and I won't mention that again. These measures are updated every week on Tuesday. And don't go back to the previous slide, but I want to underscore the fact, and I didn't say it, that this red, yellow, green, turquoise system does not apply to our tribes, pueblos, and nations. They are free to adopt different rules or different criteria or different approaches. And so it's not an automatic application there. And I think I'm committed to doing a better job to mentioning that, just to so everyone is clear on that. We also, last thing on the gating criteria web pages, we're only updating it once a week now, but we do that in concert with the red, yellow, green report, at least every other week. Next slide, please. So let's just review the full vaccination rate metric on the website today. We're at 44.8%. This, we are taking the number of people 16 and over who have a full series of vaccines, one J&J or two of the Pfizer or Moderna. In the denominator, it's all that people 16 and over in that county who are therefore eligible for the vaccine. And so you divide those two, you get the full vaccination rate. Got a lot of questions right after the press conference last week. Well, what if we add 12 to 15-year-olds? What's going to happen then? And we made the footnote, that little asterisk at the bottom. We're not planning on changing the metric with new eligible populations. Obviously, when you start a new population, their vaccination rate's going to be lower than the rest of the state. And I want to go on record that if if the 12 to 15% kids start getting vaccinated and then their rate surpasses the rate of the state in a way that would pull us up, then I'll be the first person to advocate for adding them. But for now, we're keeping those numerator and denominator constant. To meet the target, you have to be above. To get credit for the vaccine metric for full vaccination, you have to be at or above the target for the whole state. That 2-week period, the red line on the right is the actual number of people cumulatively that have received full vaccine. There's a little bump in the curve there where we did some reconciliation with the federal database, and we're working hard with our federal partners to make sure that data is right. If you watch the data by your county, you're going to notice some fluctuations. We have a little warning about that, and anytime there's a big fluctuation, we'll annotate that on the website too, so everyone can see it. But just, I want to make sure everyone's really clear. 2 weeks ago, in theory, the vaccine target was 35%. Today, it's 40. In 2 weeks, it's going to be 45%. But just a reminder, at least as a state as a whole, we're at 44.8%. We do think it's going to be harder to get the remaining group of people vaccinated, but we're hard at work. And you see that slope of the line there on the right, the solid red line looks good. But just a reminder, this vaccine target goes up by 5% every 2 weeks. And so a county that was at 45% today might be fine on the 19th of May, but then we'll definitely be behind on June 2nd when the target's 50%. I don't want to belabor the point, but just want to make sure everyone's really clear. It's the first time we've had a moving target. We've been accused of having moving targets before, but this is actually a real intentional moving target to move us all along to get vaccinated. Next slide, please. So here's our new red, yellow, green, turquoise map. It's all turquoise pretty much. Catron, Valencia are green, Chavez is yellow. And it looks like the idea of incorporating the vaccination rate really has benefited many counties. It gives counties another way to stay green or become turquoise if their test positivity rate's a little high or their case rate is a little high. I know there was some shock actually. If you remember a week ago, Bernalillo was yellow and then they turned green thanks to the benevolence of our governor who actually took these new calculations and in advance of today, put them in place. So they're green. So that's something to remember. Bernalillo was green actually on the last record, and we ran their numbers again on Monday. So Alex, next slide. You can see here that Oh, wait, before I do that, before I get into the details on Bernalillo, here they are. Bernalillo green last week and turquoise this week. San Juan, Bernalillo, both with higher case counts. But you can see we've gone from 24 to 30 turquoise counties, 6 greens to 2, and 3 yellows to 1. So great progress. If we go to the next slide, I think this is the one I was about to talk about. Yeah, this is the table taken directly from the website, the Red to Green website on the right here. And Alex, if you can point to that right-hand column, remember we said if you become turquoise, you're in turquoise, maybe put the pointer over the right-hand column. If you're turquoise, you stay turquoise for 4 weeks. So 4 weeks from today is June 2nd. Now we will still run the report. We'll still put the data in every 2 weeks. You'll see it, but all the turquoise counties will stay turquoise. That black dotted line will move every 2 weeks because that's the line that separates those who are meeting the vaccine target, which is 40 or above, with those who are below. And if you look into the second to the right column, vaccination rate, target at or above 40, you can see that all those folks above the black dotted line are above 40. I won't belabor that too much more. It is sort of a notice though, particularly to counties who are lower, you do have a chance to catch up. DOH is poised and ready to work with you, as Secretary Collins went over in detail about all the different ways we can work with you and your primary care docs in your counties. And so be aware of that. Let's focus on the Bernalillo, which is in the box there. You can see their population. You can see the number of cases. It was over 1,000, and it goes through the math. And so their case rate is 11.7, which is over the target, right? And if you look at our little table on the left, which we can provide you, if you want us to walk through it with you, if you're a county manager or mayor, we can explain. But so when we ran the report on Monday, we're only at 11.7 cases per 1,000, test positivity rate of 3.08. Their full vaccination rate was 47%. And on the 4/30 report last Friday, they had met the test positivity and the full vaccine percent. So they were green. You only need 2 out of 3. Today, they still meet the test positivity rate and the full vaccine rate, with the target being 40. So that's green, but it's now 2 greens in a row. Usually they're 2 weeks apart. This time it was last Friday and today. So 2 greens in a row makes them turquoise. And a number of counties turned turquoise as a result of that. I don't want us to ignore though or miss the column that has the average daily case rates, because there are counties there, San Juan at 28.8, Sierra at 13.5, others, Luna, Lincoln, DeBaca, Puey, Torrance, Roosevelt, Chavez, quite a few counties over 10. And particularly in those counties, you need to be very careful. Wear those masks. If you're not vaccinated yet, consider getting vaccinated. It will be your best defense. Okay, let's, I think we're just about done here. Here we are. So just a reminder from both Secretary Collins and myself, get registered now. Even if you're 12, you can get registered today. Get vaccinated. Be aware of these variants that resist treatments and are spreading more rapidly. Do not give up the mask in any indoor setting ever, vaccinated or not. It still applies if you're sick, have any symptoms, or think you may be exposed to someone who has COVID, particularly if you're vaccine negative, get tested. Anybody whose symptoms should get tested immediately. We are seeing cases of coronavirus in people who've been vaccinated, as we said last week. Check out treatments, stay committed with us through the summer here, and it's still the safest thing. Stay at home, wash your hands, wear those face coverings when you leave home and you're going to be with other people, and maintain that social distancing, particularly in those counties. This is doubly important in those counties that have the higher case rates right now. And with that, I think that about wraps it up. I guess I also would say as a primary care physician, many people, just like Secretary Collins, they see us as their trusted voice. Please, if you've not had a conversation with the person that you most trust, to give you advice about your health and about the vaccine, please arrange to have that conversation today. I get emails and text, I get all sorts of communication from my patients. You know, should I get the vaccine? You know, and in every case, I'm saying absolutely. You know, after we talk it through. So have that conversation, and I think Alex, it's back to you to take our reporters' questions.
Thank you, David, and thank you, Secretary Collins. So I'll moderate Q&A with our media partners. Please raise your hand. First, we have Tommy Lopez with KOB4, followed by Julia Goldberg with the Santa Fe Reporter, and then Chris McKee with KRQE. Tommy, go ahead with your question.
Thank you guys, as always, for giving us this opportunity. Dr. Scrace, with what you just explained, I wanted to ask about June 2nd, and I know you don't have a crystal ball, but right now, just by my quick count, about 14 counties out of the 30 that are in turquoise do not meet all three of the metrics. And by what you said, I am understanding that that means that they have been in green for 2 different evaluation periods, hence they're in turquoise now. Does that mean that on June 2nd, we're going to see a massive step back with many, many counties in all likelihood dipping back into at least green if they do not make improvements in whichever category they are missing?
That's, Tommy, a great question. And it does get a little complicated. And you're right, I don't have a crystal ball. So assuming that every county is at 50% vaccination rate, we won't have to deal with that issue. My understanding is that once you're turquoise, if you continue to meet the green criteria, you would stay turquoise. Now you'd have 3 consecutive periods. So, but it is possible if somebody met no criteria, none of the 3, to go back to red. If they met only 1, to go back yellow after that 4-week period. So, but as long as they're meeting 2, the way we've set this up is to keep people at the turquoise level. I mean, basically making progress on vaccinations is a booster for every county. And that's really the bottom line here and why we've seen this progress. If New Mexico had been one of those states that was doing the worst in vaccination rates right now, we would not be seeing anywhere near the amount of turquoise. So our vaccination success under the leadership of Dr. Collins and Parahone and many, many others is really what's gotten us to this almost all turquoise state that we're in today.
Thank you, David. Julia, go ahead with your question, please.
Alex, thank you. And secretaries, thank you. I do have a few questions. I'm going to talk really, really fast. Number one, Dr. Collins, it's my understanding the federal government has told states if they don't use their full allocations of the vaccine, it's going to be considered part of a federal pool and made available to other states. I was hoping you could tell us where New Mexico is with its allocation and if we are going to end up not using it all. I know that was the case last time we heard from you. Number two, will the New Mexico immunization exemption statute apply to the COVID-19 vaccine? And number three, Dr. Scrace, the daily death counts have been quite high several times in the last week, almost twice as much as Lannel's worst case scenario. It sounds like you don't think that's related to the variants, but I'm wondering, A, if that's true, and B, if you had some thought of what it is related to. Thank you.
Thank you, Julia. And so for the first question regarding not using all of our allocations, yes, the federal government is going in the following weeks to go to a system where whatever you don't order of what's available to you would be put into a federal pool. And then as a state, you're eligible for 50% of your allocation through that pool. But each week, the volume or the total amount of doses will be reset to that 100,000 plus. And so currently we are looking at about 50% of our doses being ordered, but we're going to up that by these efforts that we have in working with smaller events, reaching throughout the state. So our goal is to really stay at 70% or higher of what we're allocated each week. And can you clarify your question on the immunization statute?
Yes, sorry. So the New Mexico immunization exemption statute, as I understand it, only allows 2 types of exemptions for children, required immunizations to enter school. And I just wasn't sure how the COVID-19 vaccine fit in with that as we look at these younger groups.
Yeah, and thank you for clarifying. So, at this point, given that it's an EUA, it's not like a mandatory vaccine. We strongly want everyone to get it. And we know that some academic institutions are looking at maybe moving towards requiring that to return in the fall. But right now, we're just looking at this from the standpoint, given that it's an EUA, we're asking you to please get the vaccine. We're not requiring it. Dr. Scrace, I'll let you take that last one.
Yeah, one add to your comments. So the bottom line here is really we have all the vaccine we need right now, and we're going to have all the vaccine we need to meet our target by the end of June. So, but hopefully there will be a rush of people as a result of having those conversations with their trusted voices, and we'll get back up to using every dose in our full allocation. Daily death counts, Julia, great question. I just realized that the report I look at every day is a little different than the press release. And so let me tell you, that's a great pickup on your part. Basically right now, and this is the way sometimes things work in healthcare, but the OMI, the Office of the Medical Investigator, is now finally getting through their backlog of managing cases and making determinations of the cause of death when that's handed over to them or goes to them by statute. And so we're, believe it or not, catching up from an unprecedented number of deaths that were referred to them in October, November, December, and January. And so as those come through and then they are sent to DOH, the person in DOH who manages this is also clearing out that backlog as well. And so when I look at the daily numbers, I can see that, for example, when we have 12 deaths, that actually 8 of them are late reports from from more than a month old. And we'll talk amongst ourselves and figure out how we can make that a little bit more transparent. But it is just part of a process, and believe it or not, catch up from the fall, winter, when we had so many deaths. But actually, I was given a presentation to providers earlier yesterday, and to me, the numbers are actually of recent deaths are about 1 per day. And while there has been, actually, I don't know of a death related to a variant. So there have been some folks who have been hospitalized as a result of getting COVID after the vaccine. But so I'll give us a few days and let's see if we can't find a way to get you those numbers. But actually the numbers of current deaths, of course, they all get filed. The press release we send out is what we got officially today. But of course, the death gets filed back in the epidemiologic curve, and that curve I showed you at the bottom of the 3-curve slide, that gets filed of the actual date the person passed. And so I can see where that's confusing, but just reassuring the numbers are looking good right now.
Thank you, Secretaries. Chris McKee, go ahead, please.
All right, thanks a lot. Following up on the recruiting of primary care providers to join this COVID vaccination push, we know like a lot of the major hospitals and primary care providers are somewhat already doing this. So I guess I wanted to ask, what is the real drive of this effort? Is it to get to more of the smaller facilities or the other non-hospital sort of primary care providers? And any idea of maybe how many doctors you're hoping to recruit, how many are already there? Along those lines, are you going to have these doctors giving out a specific type of vaccine like Moderna or J&J? Because as I understand, those can be used in the normal refrigerators instead of ultra cold storage. And finally, is this an effort to start getting that COVID vaccination treated like the flu, where people go in for routine checkups and, hey, have you been COVID vaccinated yet? I'll hit you with it right now. Thanks.
Okay. Thank you so much for those questions. When you think about our efforts to reach out to primary care providers, yes, we are working with many of our hospitals here already as vaccine providers, and many primary care providers are within those systems, but there are also primary care providers who are out in private practice. And keep in mind that whole trusted voice, that idea of someone who can get across to their patients the value of the vaccine, that's your primary care provider. Regarding the types of vaccines, we're going to work with providers to understand which vaccine they can utilize most efficiently. And DOH will be supporting providers to get those vaccines into their practices. And so regarding the flu and this idea that if you have a patient in front of you, and like when you have the flu shot available, you ask them if they want it. Yes, very similar to that. We're going to have the opportunity for, while the patient's there, to say, have you received your vaccine? Would you like it? These are the values, and we can get a shot in the arm right there during their visit.
And I just quickly add that the federal government sort of set its sights on federally qualified health centers, which often, and particularly in New Mexico, deal with lower income populations and people in rural areas. And they're getting a good reimbursement from Medicaid right now for giving these vaccines. 90% of a typical FQHC's patients is covered by Medicaid. And so we've met with them in the past week, and they're going to be looking at getting evening and weekend clinics open. So people who work during the day and don't want to take time off work to get the vaccine will be getting it. So agree with and applaud Secretary Collins for this new outreach to a voice that many people in New Mexico trust.
And I'm sorry, I didn't answer the question about the number. It's a little over 1,500, about 1,561 primary care providers in New Mexico. Thank you.
Thank you, everyone. So updating the queue, next we have Matthew Reichbach with New Mexico Political Report, followed by Nancy Laughlin with KOAT, and then Dan McKay with the Albuquerque Journal. Matthew, go ahead.
Thank you. Yeah, I saw some news in recent days that in some other states they're exempting some of the capacity restrictions in certain areas at events like baseball games for folks who are vaccinated. So having like a vaccinated only section. Is this something that New Mexico would consider for events or things like movies, that sort of thing? Thanks.
I think really at this point, and thank you so much for your question. I'll start, and then Dr. Scrace, please add in. We really have our red, yellow, green, turquoise metric, which informs how many people can gather. And so once we get people vaccinated, we reach that 60% New Mexico, then we open up. And then we don't really have to have this conversation because then we're open. So that's really our goal, but to, continue COVID safe practices. Dr. Scrace, did you want to add to that?
Yeah, I was talking to one of our state senators, Matt, about this idea of some sort of coding in your driver's license that you could swipe and your vaccine record would be in there. Given the time horizon here and that we're really counting on getting to where we want to be in 60 days, then I think, or less than 60 days, the amount of time it would take to set up that kind of verification system would be tough. I also think, remember that there are still people who want the vaccine or maybe in a rural area or don't have a computer or have a lower income. And we don't want to do anything that might give an advantage in, to do some of these daily activities. It would end up really being based on income or things like that. So right now, it's called the passport strategy. And right now the state is not looking at that.
Thank you, Secretaries. Nancy, go ahead, please.
Hi there. I know you all addressed this, but if you can, one more time, just in a brief synopsis for viewers that's understandable, how did so many counties go to turquoise, bottom line?
Well, I can, let me start. Bottom line is vaccination success. And if you want a byline to the bottom line, it would be vaccination success, introducing the vaccination success we've already had is reflected in the new vaccine metric. In addition, we relaxed the standard numbers, cutoff points for both test positivity and cases per 100,000. So those three work together. And I think the governor, in granting that sort of retroactive almost look at the state, moved a lot of counties to green. And then this week that allowed them to become turquoise.
Thank you, Secretary. Dan McKay, go ahead with your question, please.
Hi, about almost 2/3 of the entities on the rapid response list are schools, and I'd be curious to hear what level of concern, if any, you have about that. And then second, whether this connects to your desire to get these 12 to 15-year-olds vaccinated as soon as that's a possibility.
Tracy, I'll start. So next time on May 19th, we're having a back to school special, basically, where we're going to go through all the data from schools, where we're at with schools. We got a great question last time about, hey, this is really disruptive. All these schools, the state is shutting down. And just to remember, the state only shuts down a school if they have 4 rapid responses. And so all of the school closings that we've seen, and I know there's been some notable ones in Albuquerque, were really the school district themselves deciding to close, give people some time to see if there was more transmission playing out outside of school. I will give you a little bit of a preview. Most of what we've seen in schools is mainly infections in kids. The vaccination for teachers was particularly effective. We vaccinated 70% of registered teachers, and the increase in cases with everyone going back to school has been remarkably low in the teacher population, so mainly driven by kids. And then, so that leads into your other question. So of course, as we see more infections in kids, of course, we're very anxious to get as many of them vaccinated as possible. And in fact, if there was another EUA in consideration for and good data to show that vaccinating 5 to 11-year-olds was effective, as it is with other age groups, we'd be wildly enthusiastic about that as well. Tracy.
No, I completely agree with you. Absolutely, we want to get the 12 to 15-year-olds, 16 and 17. We want to get all of the various populations that are eligible vaccinated, and that will definitely help us in our schools, which is why I'm excited about what's happening with Moderna in the summer to begin studying the value, the efficacy of the vaccine for younger children.
Thank you, everyone. Next, we have Morgan Lee with the Associated Press, followed by Brittany Costello with KOB, and then Joe Seiss with Eastern New Mexico News. Morgan, go ahead, please.
Hi, Secretaries. Hey, just looking quickly at the table you flashed and vaccination rates for county by county. It looks like, you know, some of the lower rates are in southern, eastern, rural counties, resembles slightly maybe the political map in New Mexico. What do you attribute, what's going on there in terms of any hesitancy, or is it mainly just a remoteness that's playing into that?
So thank you for the question, Morgan. Obviously, we are working to provide more information and evidence to the Southeast region, given what we're seeing with vaccination rates. And so DOH will be taking some trips to go down there, and we're setting up, more access to vaccine. So it's really, the onus is really with us as well, but also we want to encourage residents in the Southeast that, you really should get registered. You need to get your vaccine, and we really want to help that region of the state. So it's really a team effort. DOH, community members, leaders, let's get our people vaccinated. Dr. Scrace?
Yeah, and maybe this is going to be a question for you from me, Tracy, but so I think that's also possible. We heard a lot about people in the southeastern part of the state going across either one of those two borders, the eastern or southern border, to get their vaccine in Texas. It's possible they may not be in the system, or their data might not have percolated its way through. So if you're out there and got a vaccine in another state and live in New Mexico, Tracy, would it be okay for them to go in and register themselves and then enter in that they got the vaccine and the dates? And that's a really easy way to bring county vaccinations up, is to identify those people who've gotten the vaccines elsewhere. As far as political divisions, I think we've got some really, I don't keep track of that very well, and I mainly look at that table. you can see sort of a greenish shaded map on the vaccine website, but I think we've got some very high counties that ordinarily are Republican, some very high counties that are ordinarily Democrat. So I don't know that there's a political component to the vaccination piece. I mean, we had a Republican president who really got the thing started and put the machinery in place and the vaccine, the pharmaceutical industry to get those vaccines up and running and started delivery. And then we have a Democratic president that's increased production further. So I like this issue, like every issue I wish was apolitical, but I haven't not heard specific political concerns related to the vaccine so far.
And I just want to add to that, both of our current and former president have been vaccinated.
Yeah.
Yeah.
Thank you, everyone. Brittany Costello, go ahead with your question.
Hi, thank you guys so much for the time. I have a few questions. First, Dr. Schrace, you were just talking about out-of-state vaccinations. I'm wondering if you can give us an update on that. How many people have been vaccinated out of state that are now registered in our system? What portion of our fully vaccinated or partial vaccinations are from those out-of-state individuals? Do we track that? And then I wanted to ask, we have this 60% in mind moving forward to completely reopen. I'm wondering, are there any factors I guess anything that we could do as a state to hit that point sooner than the end of June with how you guys are factoring things? What would that take to hit 60% or to just reopen prior to the end of June if there is anything? And then the 60% of the eligible population, that vaccination number, what is that population number? Is that out of the 900,000 that are registered, or what does that go off of? Thank you.
Okay. So
go ahead, Tracy. I'll do the math unless you have it right in front of you.
Okay, yeah. So regarding the out-of-state vaccinations, we've worked with one partner in Texas and have requested that information regarding how many New Mexicans have received at least one dose in Texas, but have not received that response yet, but that has been promised to us. And as far as the portion, again, we don't have the data in front of us, but we're trying to gather it.
Yeah. I would add that, Brittany, that if you take the 1,680,605 people who would be eligible for the vaccine and multiply that by 0.6, you'll get 1,008,000 and an additional 3 numbers that I don't have in my head. So that's the target. The answer to your question is, yeah, if everybody gets vaccinated sooner, we'll be done before the end of June. We would love that. We would love to be done at the end of May. And I just remind our media partners here that you have a huge role to play in getting factual information to the public about the safety and efficacy of the vaccine, encouraging them to talk with their trusted voices in their lives, et cetera, et cetera. I do know that one of the issues we're currently working really hard, and by we, I mean, of course, other people, not me, but people in DOH who really are experts at this, is out-of-state vaccines in the federal database. And I alluded to that earlier about the people in Arizona. Our understanding right now is if you look through the database that we do have of people who have reported being vaccinated, that it's a single-digit percentage of folks who may have been vaccinated out of state. But we share that information in the database, and we can either look that up and get it back to you, or we can bring it back to a future press conference. But the factors, I guess the factors would be just more people to get to the end of June, to get to that 1,008,000 and some people fully vaccinated. You can, we really, there's only about a 230,000 difference between the people with 1 shot and 2 shots, at least on the Pfizer Moderna side. And so if we even got all those people vaccinated, we'd be up to 986,000. And then after that, it's only 22,000 new people that we need to get 1 J&J or 2 new doses. So I think it's eminently doable as long as counties keep up the pace and encourage citizens to talk with their trusted voices.
Thank you, everyone. So next we'll have Joe Seiss, and then followed by our final media partner question, Algernon Damasa of the Las Cruces Sun News. Joe, go ahead.
Hi there. First off, thank you all for your time. It's much appreciated. My question is, what is the state doing specifically to help improve vaccine rates? And are there currently, or will there be in the future, any private entities helping with the vaccine effort?
Yes, and thank you, Joe, for your question. So we're actually establishing the work with the primary care providers, getting doses to those providers. We're actually working with smaller units that are going to be placed throughout the state. We're actually having a vaccine events where we're going to go to a school or a church or another entity and vaccinate on site. And so we have multiple approaches we're using to increase the vaccination rate.
Yeah, and I would just say in private entities, let's not forget that the vast majority of hospitals in our state are indeed private entities. When I think of the giant vaccination efforts that Presbyterian has done, that Loveless has done, in many, many rural hospitals around the state, they've been actually involved since December in a really big way. I mean, even just vaccinating, their own 25,000 employees in Albuquerque was a huge effort. And so they've been with us since the beginning. They continue to work with us, and we'll be talking this week more about at the medical advisory team about other ways to connect this vaccination effort to primary care doctors and communities throughout the state.
Thank you, everyone. Algernon, go ahead.
Thank you, everybody. Hello, Dr. Collins and Dr. Scrace. I'm just wondering if either or both of you have any reaction to the CDC's new modeling that they reported today that includes a projected increase in daily cases through May, followed by a decrease depending on the progress of vaccination nationwide. I'm noticing that although the ratio of vaccinations to new infections in New Mexico is still 50-1, that ratio has been shrinking. And I'm just wondering if that modeling indicates any possibility that the plan to reopen New Mexico at the 60% vaccination threshold perhaps gets more complicated based on the behavior of variants, new infections, and relaxed public health mitigation strategies.
Yes, well, thank you so much for the question, Algernon. I do want to say that each day we're learning more and more about the variants, the percentage of our sequenced testing results that are showing the variants. So we are definitely not out of the woods from the pandemic standpoint, which is why we need you to wear your mask and distance. The vaccine, if we can continue along the path we're on, we are in the right direction right now, which is positive, but we definitely got to keep our eye on the data, which is what we're constantly doing.
Yeah, I would say too that it's a great question, Algernon. As you know, New Mexico is one of the, I would say we probably have the best model, one of the best models in the country, and it's all based on New Mexico data, not necessarily national or other state data. We had a very long discussion about variants yesterday, and in fact, with if you think about 65% of the cases being variants and them being 35% more transmissible, we believe the daily case counts would be extraordinarily low right now were it not for the emergence of variants. In terms of the vaccination goal, because we're so far ahead and because there's no evidence that any of these variants are resistant to Pfizer, Moderna, or J&J, we still think we have a leg up and can get there. We may see more cases during this period of time because of increased transmissibility. But the main thing to do if you're worried about that is wear a mask, get registered, get vaccinated, because that is what we think is keeping us ahead. So we did talk about this a lot yesterday, and right now we only project out accurately about 4 weeks, but our case rates are flat to just a little bit upwards, very similar to what we're seeing now.
Thank you, secretaries, and thank you to our media partners. That is the end of our questions. Secretaries, would you like to make a final comment before we close? I'll start with you, Secretary Collins.
Yes, well, thank you. I appreciate everyone's time today. I appreciate all that New Mexico is doing to get ourselves ready to open up. So please, if you haven't registered, register and get your vaccine. And I thank you all for your patience early on with some of our technical glitches. And I really thank the team. And I definitely thank my team at DOH and the other agencies for their work with us to get shots in arms.
Yeah, I would just close a couple things. Just really appreciate the media partnership and the way that you get this information out to the public in a more efficient and timely way than we sometimes do. So we appreciate that. I do want to put a call out for questions. I know when we do get questions in advance, like far in advance, it really helps us design what we're going to do. We will have Secretary Stewart with us here in 2 weeks. We plan on a very deep dive into where we're at with schools, what we're seeing with cases, closures. We're looking at some of the approaches we take and evaluating those. We may have some news about those, but any questions or things that you think are of particular interest to your viewers, readers, and the like, get those to Jody or Matt Bieber or Matt Nerzig, who are, do a great job collating all that information for us, and we can kind of set our sights in that direction. And then, as always, wear your mask, talk to your trusted partner about a vaccine if you haven't gotten it, and hopefully that trusted voice in your life who gives you sound medical advice will recommend that you get the vaccine, and that just will move us one day closer, one vaccine closer to July 1st. We're all looking forward to that. Thanks very much. Stay safe. The pandemic is not over. Keep that mask on when you're outside, unless it's one of the exclusions in our new mask guidance. Thanks, everybody. Bye-bye.
Bye.